I'm Dr. Michael Rothkopf. I'm the medical director of RxNutrition. I'm also a clinical professor of medicine at Rutgers University, New Jersey Medical School, and I'm the former president of the National Board of Physician Nutrition Specialists. Today's video is a case study and a review on the physician's nutritional evaluation for a hospitalized malnourished patient. The physician's nutritional evaluation is a unique set of tools that includes specific components in the history, physical, and data review, such as the laboratory parameters and other components, such as the body composition. This module is intended to teach you the aspects of the physician's nutritional evaluation so that you can utilize it in your clinical practice. This can apply to practically any circumstance that you see a malnourished patient, but it is especially relevant to the hospitalized patient with malnutrition. You probably already know that something like 50% of elderly patients have some degree of malnutrition when they are hospitalized, but you might not know what an impact this has on patient care. Malnutrition increases the morbidity and mortality of patients in the hospital, and it increases their length of stay and, of course, increases the cost of care. In fact, it's been estimated that malnutrition in the hospital costs the US healthcare system something like $50 billion a year. So this is obviously something that we need to address. If you like what you see in this module, go ahead onto our website and sign up for our course. This is a course designed by experts in the field, and it's intended to give you all the scientific background you need to apply these nutritional principles in your practice. The tools you're going to see in this module on physician nutritional evaluation are the same ones that I use every day in my clinical practice. I have seen thousands of patients and evaluated them using these techniques. And it's not just me. Physician nutrition specialists all around the country, in fact, all around the globe, use these tools. Our goal is to teach these to you so that you can apply them for your own patient care. I hope that you enjoy the module we put together. We think it's really terrific, but you be the best judge of that. Good luck.
The physician's nutritional evaluation of a hospitalized patient being considered for nutritional therapy is a complex process that starts prior to the receipt of any nutritional regimen and continues through to the point at which the patient resumes adequate volitional intake or is being fully supported by nutritional therapy and is discharged from the hospital. The initial evaluation involves assessment of nutritional status, determination of nutritional risk, analysis of body composition, and a calculation of energy and protein requirements. The identification of malnutrition by such assessment tools as the Global Leadership Initiative on Malnutrition, or GLIM, impacts the need, urgency, and manner in which nutritional therapy is delivered. Energy requirements may be determined by simple weight-based equations, published predictive equations, or by indirect calorimetry. Similarly, protein requirements may be determined by simple weight-based equations. Analysis of body composition by computerized tomography scan, dual emission X-ray absorptiometry or DEXA scan, or bioelectric impedance analysis is important to assess for presence of sarcopenia and evidence of reduced muscle strength and quality. Loss of muscle mass and function has been linked to delayed recovery following discharge from the hospital. The clinician should be aware of which laboratory parameters provide valuable information on nutritional status, which represent acute phase reactants unrelated to nutritional state, and which parameters are of little value to the initial assessment or ongoing monitoring of the patient receiving nutritional therapy. The initial physician evaluation should identify any patient at high risk for refeeding syndrome, which in turn would necessitate closer monitoring of electrolytes and volume status and require modifications in the rate of advancement of the nutritional regimen. As feedings are initiated and advanced, feeding protocols should be implemented and patients should be monitored for tolerance, interruptions in delivery, and adequacy of support. At the end of this activity, you'll be able to identify the clinical issues involved with a physician nutritional evaluation, including determination of nutritional risk, assessment of nutritional status, and analysis of body composition. Calculate energy and protein needs and assess risk of refeeding syndrome. Describe which parameters should be monitored as nutritional therapy is initiated. Identify the limited value of certain traditional surrogate markers of nutritional status and adequacy of nutritional therapy. Now, let's meet the patient.